tearing of the meniscus. So, Edward, we kind of want to just kick things off with talking about that and give us your take on why that might happen.
Very good. So meniscal tears are very common, and we see these a lot in the clinic. Obviously, we have a lot of patients coming in with meniscus tears or diagnosed with the idea of maybe that they're having issues with their meniscus. Many times we get the question, what is the meniscus? And obviously patients a lot of times are kind of perplexed. What is it? What exactly is a meniscus? So basically a meniscus is a circular structure, as you see here in this diagram. It's a circular structure, and there's two of them, one on the lateral and one on the medial side of the knee. And basically it's a cartilage-like substance that sits between the femur and the tibia. Now, think about these meniscus as shock absorbers. So basically, they're shock absorbers that attenuate forces or compressive forces that are sitting or landing in the actual knee joint between your femur and your tibia. Now, a lot of times patients come in with signs and symptoms consistent with meniscal tears. So what happens is a lot of times this can be either from a traumatic type injury, as you would see in sports, or maybe a misstep or a fall, a slip and fall resulting in the actual meniscus being torn. Now, the mechanism of injury for a meniscus tear a lot of times is a flexed knee, so meaning the knee is in a bent position with some type of rotational force. And if you can think about that in your head as a visual, you would see if you were to flex your knee and have a rotational force in this area here, you could very well see how this femur would be caught inside that meniscus here, and some tearing would occur. And this happens very frequently. So a lot of times patients will come in with meniscal injuries and tears. And a lot of the symptoms associated with meniscal tears is a lot of swelling, locking, popping, and that type of symptom. So a patient will come in and say, I'm having a lot of locking sensations with my knee. I feel like my knee is getting stuck, and I'm hearing a lot of clicking within my knee.